Hi, everyone. I'm Maggie McGrath, editor of Forbes Women. We have seen the Department of Government Efficiency, also known as DOGE, make cuts to thousands of areas of the federal government. A lot of these areas affect women. My colleague, Emily Baker White, has a new story on Forbes.com pointing out that the man kind of in charge of DOGE, Elon Musk, has long claimed that civilization will collapse unless we raise the birth rate. But DOGE is slashing billions in funding for pregnant and nursing mothers and their children. Emily, thank you for joining us to discuss this story.
I'm so glad to be here.
Emily, we've seen tens of thousands of government workers lose their jobs over the past few months. So many programs have been cut. We've been looking at US aid. We've seen cuts at NIH, CDC, and beyond. But you took a really comprehensive bird's eye view at everything we've seen from DOGE, and you come to the conclusion that women and children are really affected. And this is counter to what Elon Musk and President Trump have said in their own personal lives and on the campaign trail. Can you just talk about what drew you to this story?
Yeah, what drew me to this story was this bizarre tension. I was looking at a list of all of these terminated grants to go do science and healthcare in a bunch of different ways. And I kept seeing maternal and pregnant and other terms that sort of specifically looked at helping people start families, helping people get pregnant, helping people deliver babies safely. And I was like, why? This is the fertilization president. We've got like Elon Musk saying civilization is going to fall if we don't all have more babies. Why are they cutting funding to programs that are trying to help people get safely pregnant? And I did not find a satisfying answer to that question. But I did talk to some of the people whose work has had to stop. And what's really clear is whatever the intention of these cuts, they are affecting people who are trying to get pregnant. They are making it harder for people to get pregnant safely, to deliver babies safely, to go through the postpartum period safely. And it just does not make any sense.
Let's dive into some of those stories you've heard. Is there something that rises to the top of your mind or that you haven't been able to get out of your mind since talking to your sources?
Yeah, so one of the folks I spoke to, several of the folks I spoke to, worked on a grant that was given to something called the New York Champ Center of Excellence, and this was a hospital center that focused on providing care to local New Yorkers, and especially those who might not get care in other ways. And two of the things that are most likely to cause harm to a mother right after she gives birth are cardiovascular complications and postpartum depression. And this intervention that was funded by this grant had doulas checking in with moms and pregnant people every day, right, to make sure that they were okay. These folks were giving like food deliveries to people's houses when they needed food. They were doing lactation appointments to make sure that folks knew how to breastfeed and were breastfeeding successfully. And all of this work had to stop on a dime. And the folks who were involved in facilitating this grant, they were members of the community. And so they had to go to their neighbors, to their friends, to like people at their bus stop who they were helping and say, I can't help you anymore. We were told to stop. And when you've created that sort of community fabric, being told to stop on a dime is so disruptive to that group of people. And it takes a lot of trust to work with folks in this way. And it takes a lot of trust to talk about your reproductive health, to talk about your pregnancy with a member of the community. And that trust was just shattered when the grant was canceled. And one of the most amazing things about this is these people are still delivering food. They are still going. They're not getting paid. They're not employed. But they said, I'm not going to leave this person. I'm not going to leave this person who needs my help. They're taking food out of their own fridges and delivering it to these new moms. And that I cannot get out of my head.
Oh my goodness. Well, we've seen through Forbes Women the statistics around doulas and how doulas can improve pregnancy and healthy birth outcomes. And so can feel like a lot of these cuts are just ignoring the scientific and medical evidence we have for some of these programs. Did you get anyone in the administration to respond to that aspect specifically?
We didn't, but interestingly, one of the people who worked on the study told me, it actually was probably saving money. It was probably saving money to have doulas going in and helping these folks and making sure that they don't develop problems that they're going to have to get solved other ways, right? If you like an ounce of prevention is worth a lot, and most of these folks were on Medicaid anyway, right? And so if they did develop complications and those complications weren't caught until later, it would be many thousands of dollars in the hospital to help them, and that's taxpayer money too. So to cut a program that was likely saving taxpayers money and preventing people from serious injury or death doesn't make a lot of sense.
It's true for this specific program, and it's also true as you zoom out, as you do in this piece, and you look at the comprehensive aspect of these cuts. We've been covering the cuts to the CDC team covering infertility research. There's no one at the CDC right now who is an expert in infertility or IVF, and that's just one other team on top of the teams that you spoke with. Are we able to extrapolate the effects on public health that we could see in the next year, 2 or 5, if these cuts remain in place?
Yeah, so this is one of the really hard things, is that there is a lot of disruption right now. There is a lot of pain right now. But a lot of the folks who were doing work at the CDC, at NIH, through these grants, were collecting data. And that data was going to be useful next year and 5 years from now and 10 years from now. That is how you determine what you need to do in order to improve medical outcomes, right? It is only by studying data from the last year and 5 years and 10 years and 20 years that we see trends and we say, oh, we shouldn't do the IVF procedure this way. We should do it this other way. It's safer. And if you're not collecting all that information, it's going to stifle our ability to advance science down the road and actually make medicine better for people. And so these folks doing this core research is often like, yeah, you were doing research. I don't really exactly know what you do. You weren't like directly working with patients, so it's probably not that vital. No, because the folks who are doing that core research and working with those core data sets, they're using the data. They are analyzing the data, creating the data, synthesizing the data, housing the data that every medical professional in the country uses. And so the disruption to this core system, it hurts now. It's going to hurt worse in a month. It's going to hurt worse in a year. It's really going to have ripple effects that we can only begin to think about.
One of the questions I've been asking my sources is there a private sector solution who can step in, right? As a Forbes reporter, as Forbes reporters, we both know the amount of philanthropic dollars that exist out there. I'm curious, Emily, what have you heard from your stories? Is there a billionaire or a foundation who could step in and emergency fund some of the programs that you looked at that have been cut?
I know there are people trying to figure out what to do next. When you lay off huge trenches of very passionate, very highly educated, wicked smart people who are trying to advance science, those people are going to band together. They're going to say, what do we do? They're going to try to figure out the way to keep doing the work that they love no matter what. And so I think time will tell what those folks choose to do and where they choose to put their efforts, but they're not done.
That's the one bit of hope here. I want to pivot a little bit because the story that you published today looks at this issue through the lens of Elon Musk, who, as you note, is a father to an estimated 14 children. You write, Musk has said he thinks civilization is going to crumble if women don't have more babies. He has offered his sperm to acquaintances and blames birth control for decreasing pregnancy rates. Quote, it should be considered a national emergency to have kids, he wrote last summer. So as important as it is to look at the programs that have been cut and the effect to women, you do frame it through Elon Musk. Why was it important to use this framing?
Because I think a lot of people listen to Elon Musk on this stuff. And I think a lot of men listen to Elon Musk when he talks about this stuff. And birth rates are falling. Okay, you want to do something about that? Maybe not this. And so I think it's important to meet people where they're at. And there are a lot of people who do think that the birth rate is a really important issue. And there are a lot of people beyond Elon Musk who think that. And I think it's worth engaging with those people to say, hey, if we want to make pregnancy more successful for more people. And we want to make sure that children have the healthcare funding that they need so that when people do have children, those children have better outcomes. Like that seems like something that should transcend partisanship. It's not partisan. It's not about anything except making sure that people can have the families that they want to have.
Before we started recording, I was asking you if there's an aspect to all of these cuts that the public is missing, and you talked about the term woman. Can you share, now that we are recording, with our audience what you told me about how some of these cuts were made?
Yeah, so I can't speak to specific programs that were cut. We don't know exactly why programs were cut, but there has been a lot of reporting that in order to cut programs that they thought were affiliated with DEI, the administration went through and basically control F'd grants for words like Black, brown, BIPOC, underserved, and woman or women, right? The problem is in medicine, there is medicine that is just for women. Breast cancer only affects women. Ovarian cancer only affects women. There are all sorts of conditions that come up in pregnancy that only affect women. Preeclampsia being an example. You can't write a grant to study preeclampsia and not mention the word woman or women. But if the administration was just looking for anything that had the word woman in it, then you're essentially stopping women's health and women's health research from happening. And I don't think anybody actually wants to do that. I just think in some ways, Musk has taken move fast and break things and brought it to the government. And if DOGE had gone a little more slowly and used a scalpel, they might have been able to get at the things that they actually wanted to get at without doing so much harm. And hey, Black women have specific medical needs too, right? And so if you start excluding Black from every grant, you are going to stop Black women's healthcare. Hispanic women have distinct needs, right? In medicine, we can't say that everyone has to be treated the same all the time, or we're just leaving valuable science on the table. We know that people's bodies work differently, and we want to try to help everybody be healthy, and that should be the goal. And the story I wrote today, the program largely served Black women in New York City. Black women in New York City are more than 9 times as likely to die in childbirth than white women in New York City. To treat everybody the same erases that disparity, and that does a disservice to everybody. If we want everybody to be healthy, then we need to take each person, each human as they are, with whatever protected characteristics they might have.
That's a nuance to the DEI thesis as a whole that is getting lost in all of this, I would argue. But I do wonder, you mentioned Elon Musk is taking a Silicon Valley move fast and break things approach to the federal government. And I've heard other sources describe this as, well, they're waiting to see where the greatest outcry is. And if enough people are angry enough, they'll rehire some of these folks or walk it back. Part A of my question is, what do you think of that opinion? And part B is, have we seen enough outrage?
I don't think we've seen enough outrage. I think people are still even understanding what this means. I also think gauging outrage is a very bad way to go about cutting things. If you cut things first, you're losing talent. You're losing some of the best scientists in the country. Are they gonna want to come back if you say, oh, actually, your job still exists? I wouldn't necessarily. I would look for a stable job. I would look for someone who values me, and I would look for someone who's not going to do the same thing again 2 weeks later. I think the amount of thrash, the amount of instability in the administration right now is causing a massive leach of talent away from the administration. Even people who aren't laid off, people are leaving because they don't want to be a part of this, and because they don't think it's working or salvageable or as attractive a job as a place that has a more stable approach to science.
So you posted this story today. Have there been any early reactions from readers or your sources that are worth sharing or that you'll be thinking about going forward?
I think people are sad, and I'm sad. It's a sad story. It's an incredible story of community resilience, but it's also, we should not need to be resilient in this way. And I hope that we don't have to be resilient in this way as much as folks have had to recently.
We should not have to be resilient in this way. I think on that note, on that somber note, but maybe perhaps hopeful fuel for those who wish to move forward, I will leave it there. Emily Baker White, thank you so much for joining us and talking about your very important story. For folks who want to read it, please go to Forbes.com. Thank you so much.
Thank you.